Hi everyone. I am here to give you a quick refresher on how to use an EpiPen, should you need to do that while you are chaperoning students on the ski club trip. The first thing to know is that each ski club bus has a first aid backpack, and in that I have packed emergency medicines, and those would include the EpiPen, Benadryl, inhalers, and diabetic supplies for those students that have those conditions. So today I'm going to talk real quickly about how to use an EpiPen and the reason why. So there are several students that are going on the trip that have food allergies, and these allergies could be allergies to nuts, to walnuts, to eggs, to milk, to seafood. And they could have had an accidental exposure to these food allergens on the bus, or maybe even at lunchtime. Maybe they had a cookie and didn't realize it had a nut in it that they are allergic to, and now they're showing a reaction. That is a possibility. So you need to be prepared in case they do show a reaction. The first thing really to do is if a student is having a reaction and they have been identified as having a food allergy, is to pull out in the backpack the food allergy action plan. So it's right here. You've seen these before. It has their name and it has the different kind of a flow chart on what to do. So two different kinds of reactions can occur with a food allergy. One not serious and one very serious. So, and every student's going to react differently. Some students never have a mild reaction. They always have a serious. And so that's why we have to be prepared. So you're going to pull out the action plan and look at it. And for symptoms such as a simple rash or hives, it may say on the plan that you can go ahead and give the student Benadryl. And Benadryl would come in their emergency pack, which looks like this. Okay, so a little bag like this with their name on it. And in there would be Benadryl. So let's say they have a hive or two. You're still going to contact their parent, and you're going to tell them what happened, that they had a cookie, and they might have had a nut in it at lunch, and they're having a reaction that's mild at this point. So you're going to do that regardless. If they would have a severe reaction, you're going to have to act using an EpiPen. And that could be the case for some students who never have mild reactions. They only have severe. And again, here's the flow chart, severe reaction. And those things would include things such as short of breath, wheezing, repetitive cough, throat tightening, throat swelling, tongue swelling, anything that involves the respiratory, anything that involves cardiovascular, as in heart rate, any confusion, being pale. That would be a serious allergic reaction that needs quick thinking, and that would be an EpiPen. So let's go right to the EpiPen, because you have had some training in the past, so I don't need to go through all the details of food allergies and exactly what the body's doing. So the first thing you're going to notice when you pull out from the emergency bag that was in the backpack is that the EpiPen, if it's this particular type, is in a little plastic case. Pull that plastic case out, okay? Now I know this is a trainer, so don't worry, it's not a real one, but let's pretend it is a real one because we're training here. The first thing you're going to do is pull this off, okay? Now this needle, which is on this side, is ready to eject. You're going to hold it like this. You're going to ask the student to sit down. You don't want them standing up. You're going to ask them to sit down, and then you're going to go ahead and administer the epi. And you do that by going to their part of their thigh on the side, pushing and holding. And I'll try to see, you can see what I'm doing there. And I'm holding it for 5 seconds, and I'm releasing it, okay? That is how you inject an EpiPen. You want them obviously sitting down. You don't want to have that standing up, even though the, oops, I don't have anyone helping on that one. So now some students have more than one EpiPen in their emergency bag. So if that child after 10 or 15 minutes is not showing an improvement to their symptoms, then you will have to administer the second EpiPen, okay? And the second EpiPen may need to be administered. Not every student has a second EpiPen, so that could be an issue. After you have administered an epi, you have to call 911. There is no choice. They will need advanced medical care. So please, please call 911. Okay, the last thing to cover is a second kind of epinephrine pen, and it's called the AviQ. So the AviQ is great because it is self-explanatory. This one is the trainer, and the way it works is by taking off first the safety cap, which is this. Well,
this trainer contains no needle or drug. If you are ready to use, pull off red safety guard.
Okay, see, I'm glad it gave me instructions.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. To inject, place black 5, 4, 3, 2, 1. Injection complete.
Okay, so as you can see,
this trainer may be reused for training purposes. Replace the red safety guard and gray outer case.
Okay, so that was helpful because I actually didn't realize this had a case.
This trainer may be reused for training purposes.
Turn it off.
The red safety.
Okay, now it's off. So anyhow, even with this, which I'm less familiar with because it's new, it was helpful to have that talking person to give me information on how to use this one. Again, this one has epinephrine, this one has epinephrine, 2 different styles of delivery, but for emergency medicine to be administered. Okay, so this concludes your refresher for using the EpiPen. Hope you feel confident. If you have any questions, stop by the clinic. I'd be happy to help. Thanks.